Hi everybody, Ryan Mullen here from Advanced Physical and Aquatic Therapy, hashtag Advance Your Health video project. Today is Friday, so we are doing Ask a PT Friday. We put our heads together on this question. It comes from Johnny Vieira. It says, what is your recommendation for De Quervain's tendon inflammation and stretching procedures? So first part of that is tackling what is De Quervain tendinosis or tendinitis. It's basically just the extensor tendons of the thumb side of your wrist are getting what they think is inflammation, but it's really not a lot of research showing that that's even inflammation. They're getting tight, ropey, painful when you grasp your thumb and do this motion, like a hammering motion, should cause pain right here. That's typical of De Quervain syndrome. I'm going to tackle this by addressing if it's a grasping, gripping and twisting type issue, which it typically is. I believe that it's going to have to do something with these forearm gripping type muscles. So we need to address these to be able to remedy this. So in order to address that, part one is just going to be grabbing a lacrosse ball and spending about 3 minutes just rolling up and down from the bottom of your wrist up to your elbow where it meets. So all these wrist flexors. We're going to roll these out for 3 minutes. Then we're going to flip the lacrosse ball to the other side. We're going to find these ropey, knotty forearm extensors, and we're going to roll up and down here. We can even put a little pressure and do some wrist circles. I feel like some cracking in my wrist going on right now. Clockwise, counterclockwise, rolling more gentle, rolling with our hand, and then a little more intense by finding that knot and kind of doing a little bit of a circle with some pressure on that knotted rope muscle. Last thing I'm going to take away from this is a lot of that kind of thumb lateral wrist or medial wrist is getting really hit up when we text. When we text like this, okay? Or even more so when we text like this. So now we're entrapping everything all the way down our brachial plexus. So what I suggest is you either use Siri and talk your text messages in, or you get real weird and you keep your posture up like this and you touch it with one finger to type it in. It's a lot slower, but this is ruining you right here. Okay, I hope that helps, Johnny. That's it for today's question. I actually have another one coming up in a little bit.